At the KSMO studios, time for our spotlight on the Salem Memorial District Hospital, and Dr. Bland has made it in. Good to see you. I haven't seen you since January.
Yeah, it's been a while.
Very good. How are things going?
They're going really well.
Good. Very
Definitely
good.
getting
Very
busier.
good. You're involved right now over at SMDH Family Medicine with the free sports physicals that's going on right now.
I am. Mm-hmm.
So all somebody has to do is make an appointment. If you have a child that's involved in high school athletics, you can get them a free physical. Mission does require those physicals every 2 years now. It used to be every year, but every 2 years. But if you're going to be doing sports camps this summer, and you can probably really, Tiffany, tell me more about this because you'd probably be seeing more of this when you were going through school. But it seems like a lot more younger people are suffering illnesses, or they're detecting with better technology today about injuries or maybe even illnesses that maybe in the past might have slipped through a physical.
Yeah, I think, as we learn more, we definitely catch more, but I think we're also seeing more because we have a lot more kids here playing year-round sports.
That's true.
So I think we catch more in that way, too. But, definitely the way we're treating things are a lot differently. Back in my day, maybe we didn't take concussions as seriously as we do now.
What's
we
that?
Take those
Just
more.
got your bell rung, right?
Yeah, so
You
now
played sports.
I did play sports,
Yeah.
yes.
A couple elbows to the head here and there. Were you a basketball or volleyball player?
Basketball.
All right.
I played a little volleyball, but I was more basketball.
That wasn't your love. Basketball
No,
was your
I
love.
decided to spend more time on basketball.
Okay, so you know what when they talk about concussion protocol,
Yes.
they want now what you have the baseline is where you started, and that's where they want you to be before you're able to participate again. But so sometimes if you never had a baseline, how do you know what it is?
Yeah, I think we just know what we see in most patients, and we can go based off of that baseline. And for most everybody, it's going to be the same. We do have some outliers that we have to be a little more careful with. And oftentimes talking to the parent or coaches kind of gives us more information for that.
And there's signs that the person themselves can watch for, or parents, especially if you get your bell rung, as they used to say in the old days. They say, first off, watch yourself if you get nauseous, if you get dizzy.
Yes.
But don't go to sleep. They don't want you to go to sleep right away, because if you do get nauseous or dizzy, you may, when you get up, be disoriented and actually hurt yourself.
Yeah, that, and I think that recommendation also just came from wanting to keep a closer eye on people. And so if you went to sleep, it was harder to tell.
Yeah,
what was going
right
on.
away. Yeah, eventually you
Yeah.
need to take a little nap somewhere down the road. But
Yeah,
I think it was
eventually
like
sleep
for
is
4
going to
to
be an
6
important part
hours.
of the recovery
Sure,
process.
actually is. So, it's good that we are more serious about it, but a lot more better sports equipment has happened. Better football helmets.
Yes.
Better batting helmets for baseball and softball. So if you get hit in the head with a ball, you're protected so much better. But as I mentioned, though, you played basketball. Those elbows fly, and if you just happen to go up for a rebound and come down the wrong time, somebody's elbow is just getting ready to pop you one in in the side of the head is the love tap, right?
I was pretty fortunate. I never had any major injuries when I was playing, but, I had a sister who had multiple concussions, so I got to see that firsthand.
Firsthand. Yeah, and it can be a little bit dangerous. But other injuries, too. I was actually talking to your mom about this when she was in, and we were talking about injuries and a lot of things anymore today, is that a lot of people, when they come in for a physical, and maybe they've kind of tweaked something here or there, they need to tell the doctor this when they're getting the physical, because a lot of times you can have a small tear, you can have maybe a strain or something of that nature, and you don't say anything. You get through your physical, you get out there in the first week, and all of a sudden you do more damage because you just didn't come up front and say, I tweaked my knee, I tweaked my elbow, I tweaked my ankle, something, to where the doctor say, okay, well, we need to watch this for a couple of weeks. You may need to stay off it, right?
Yeah, I think the fear is that we're going to say no, or we're going to fail them on their physical. But really, it's important to let your doctor know so that we can, use our best judgment to determine if you're ready to play or not. And in the long term, you're going to get more playing time from that because we're going to avoid any major injuries.
We all want to push through it, right? You're an athlete.
Yeah, I did it myself as
I
a
know.
child.
I did it many times when I played college hockey. You didn't want to dare tell the coach you couldn't play.
Yeah,
or practice,
I get that.
because then you'd be nowhere near the starting lineup or even in the lineup.
Yeah.
But it's a fact, though. Sometimes And I think they're more conscious of that today
I think
in the
so.
sports.
Yeah, I think they watch for it closely.
Because they don't want long-term injuries. That's just the worst thing you can do.
Especially when you're so young, especially if you have potentially a career ahead of you
Right.
playing sports. So.
But one of the things and what we're talking about with patients coming forward is swelling and things of that nature. You know, if you're out there throwing a ball and your elbow swells and you need to tell the doctor this in the physical. You may have a bone chip, you may have a spur, you may have already torn something in your elbow. I can honestly say that for years and years when I played baseball and stuff, I tried to throw curveballs at way too young age, and I ruined my elbow. But I could still throw hard, but pitching was done. You know, I didn't even dare try that. But as you mentioned, as you get older and older and older, well, of course, I didn't realize I had already torn my rotator cuff and had bursa issues in my elbow. And, over time, you don't have the strength you used to have when you get older. All of a sudden, you can't grab something. Your feeling may be changing a little bit because of those injuries, correct?
Yeah, well, and that's a good point, is that not only if you have a career in sports potentially ahead of you, but also just any career that may be a little bit physical, you could be doing permanent damage there. So it's important to let your coaches know and let your parents know, and then, if it's bad enough, to get checked out.
Right.
And to mention it at your sports physical.
But mention that right up front. Swelling is something that usually indicates that there's a problem. And usually it does it very easily because you see your knee double up in size, or your elbow swell up, or your shoulder's going to ache big time. And don't be afraid to tell a doctor about that. Sometimes really is nothing.
Yeah, and we'll let you know if we think it's nothing. But, we can let you know if, no, this actually is abnormal and we need to work this up a little bit closer.
One of the nice things about Salem Hospital, though, with the new MRIs and the CAT scans and things that can be done now, boy, you can detect something minute that
we can.
Years ago they wouldn't even have seen.
Yeah, our MRI, it produces really great pictures, and so we can see a lot of detail and a lot of things that we, weren't really catching before. So
to make that free physical appointment, just call 729-8000, and they will be glad to make that appointment for you. You can see anybody there for the physical.
Yeah, anybody, and usually any time. We have a lot of openings for that.
So definitely want to make that call. Appointments are best. If you want to walk in, try and take a chance on.
Yeah, you just might have a little bit longer wait if you walk in.
You might have a wait, yeah.
But we do accept walk-ins.
Sure, absolutely. Not a problem with that. So definitely want to talk a little bit about that. Well, you're involved in something that I think it's absolutely fantastic, working in association with our Denton County Health Center. And you might want to give us a little bit more detail on that program, because it's very, very, very important that people understand this program is available and open right now.
Yeah, so I'm involved with the Show Me Healthy Women through the health department. And it really is a great program. We do offer free breast and cervical cancer screenings for anybody who qualifies. And I just want to stress the importance of doing these screenings, because we can find things really early on before they ever become a problem. It's, when we don't do these screenings and we find them later that, people are so afraid of, that's when we run into the higher complications, and it's just a lot more difficult to treat. But yeah, it's ages 35 to 64. It can be for older if you don't have Medicare Part B. If you're not sure if you qualify and have questions, the ladies over at the health department are, definitely there to answer any questions that you may have. But the other great part of this is that if they find something, you may be able to get treatment for free as well. Yeah. So yeah, it's a really great program. I don't know the next date right now, but I'm working with them to find out when that will be.
We'll call Health Center, and
they should definitely be able to give you any information.
They'll put you on the list, right, and whatever date is decided on. But now, this once a month is when you help them out, or is this?
Currently, right now, for me, I know that they're working with other providers to get more dates, but we're pretty flexible right now.
And so when they do undergo these tests, is that being done out at SMDH?
They do the mammograms over at SMDH. We have a great mammogram machine over there.
Yes,
and so, obviously if we find anything abnormal, we have to send off for more testing. But like I said, that could be covered as well, depending on what they say. But right there, we do the pap smear and the breast exam. So
Okay, very good. So it's all right here, so you don't have to travel, and that's what my whole point
Yep,
was. If you
all in
come
Salem.
come to the health center, and now this is all being held at the health center, correct?
Yes, at the health department. Yep.
Okay, so you get to meet the people, sit down with them, discuss
Yeah.
with them, and get to know them a little bit better. And
Well, and yeah, I think that's another great point is that we have so many things that are offered through our health department that probably people aren't aware of. And so, by going there, you might find out that there are more things offered to you. So,
Dr. Bland, a lot of people think that there's competition between the Denton County Health Department and the Salem Memorial District Hospital, and there's not really competition. It's a coordinated effort to keep people healthy, isn't it?
it certainly is. I don't see any competition at all. I think, however, we are able to provide the best care for our patients is my only goal. So,
Because I know if somebody said, well, if I got a tick bite, do I go to the health department or the hospital? I said, if you got a tick bite and it's getting inflamed, I'd go to the hospital. They're going to send you to the hospital if you go to the health center because they're not going to touch that.
Yeah.
But the neat part is when the hospital does get the diagnosis done, remove the tick, get that out of there, those results go back to the health center because then they report that to the Centers for Disease Control, correct?
Yeah,
With
yeah,
the
and
state
that
of
reporting
Missouri.
is important because if you look at the CDC website, it will tell you that a lot of the tick-borne illnesses aren't necessarily endemic to this area. It means we don't see them, but I think there are probably a lot more out there that just aren't getting reported because we see some crazy things come in this area. I know a lot of people who have had tick bites and have had something, so definitely have to watch those, especially this time of year.
Yeah, and I was going to say, in your studies, sometimes a tick bite, even if you get it, and I was just hearing the other day, they've kind of changed this. If you get that tick off within 24 hours, you're probably good. Now they're saying you want to get that off as soon as possible because some tick bites, it may take years to come out, but when they do, it may be from an exposure of less than an hour.
Yeah, I think it depends on what illness you're looking at and the tick, obviously, but the sooner the better for sure. So you just want to check for ticks immediately after going out.
And don't just yank it off.
No, you want to be careful, actually, because if you squeeze the body of the tick, you could be injecting, more disease by that. So you actually want to get closer to the head of the tick.
Right, and try to remove
And
it
usually
slowly.
tweezers are a little bit better, but if you don't have tweezers available, just get it off by squeezing the head. But
So, one thing that I really didn't know that we were around Denton County all that much is in some of the creeks, there's some leeches.
oh yeah,
Yeah, that are, and now people are getting more, seem to be finding leeches a little bit more than ever. And that's, again, not something you just want to reach over and just yank off either, is it?
No. We don't have to worry. I mean, leeches are gross, don't get me wrong, but you don't have to
That's
usually
a
worry
good doctor
quite
term.
as much.
It's gross.
They're not as known as ticks to, transmit certain diseases. But anytime you have a break in the skin, obviously there's risk for infection there. And you don't want to have a leech on you that's just been swimming in the creek. So.
Well, no, and especially if you don't notice it. Usually, and a lot of times you don't. When you get out of that creek, you really don't know they're on you, especially if they're on your back.
Yes.
You may not even know they're there until you take a shower, you start washing, all of a sudden you feel something
and usually
clinging
there
on.
are certain parts of the water that are going to have more leeches, but I've definitely seen them just swimming in the current too. So
They're there.
you got to be careful.
Yeah, you definitely want to be careful. A lot of different things that are going on this time of year. One of the things I wanted to ask you about, because there are definitely some signs of heat exhaustion. We just happen to be in May, and we're hitting near 90 degrees. Heat indexes have been over 90. And I know a lot of people are attending to their gardens, and right now, after all this rain, trying to get them in shape to produce their fruitful, bountiful vegetables and fruits that they want to have. But yesterday afternoon, about 1 o'clock, it was brutal. And I think people may not take that to heart because, I've worked out in the sun before, but we're going from 58 degrees last Tuesday for a high to 91. That's pretty brutal on your body.
Yeah, and I think it's supposed to be in the 90s the next couple days,
It
too.
is.
I mean, you would know better than me. But, it's definitely important to take breaks, hit the shade, go inside, cool off, drink lots of water. But you definitely have to watch for that. And I think you're right. In the past, we haven't really taken it seriously. We're like, I just don't feel that great because of the heat. But, yeah, if it gets severe enough and we're dehydrated, it has an effect on our body. So.
Well, your body's just not used to that change. It's like going the other way, though. If you were out in the summer and all of a sudden you come across a 40-degree day, it's going to feel a lot colder because your body hasn't acclimated to that change in temperature.
Yeah.
Even from Missouri.
I was going to say Missouri, it's a little different.
Well, I know we swing, but Missouri is really weird
Yeah.
in a couple different ways. So number one, we don't normally have dry, cool nights. Our nights, just like we have had 69 degrees, but our humidity is 98%. That's not a dry, cool night. You get out in the desert, and it's going to be 45 degrees, but it's going to be dry.
Yeah.
But it's but it's still cool, don't get me wrong. But it's not got that moisture content to it that you really feel that cool.
Yeah.
But it's there, and if you sit there long enough and you feel your skin, you'll feel it's cool. But without the moisture content, especially from Missouri, your body doesn't react to it as quickly. And so, as you're right, if you're not from Missouri and you come here, people just die when they get to Missouri. How do you guys live here? That in Florida, when the humidity levels are so high and the temperature gets up, you're going to perspire and you're going to get wore out, and heat exhaustion can happen pretty quick.
Yeah. Well, not only do we have such terrible humidity, we're also right in allergy season, and the pollen has been terrible. So I can see how a lot of people would come here and not be able to breathe. So
Yeah. Tree pollen right now, very high.
yes.
And I just looked this morning, and it looks like the grass pollen is about ready to get into the high category as well by this weekend.
Yeah.
I know you're thrilled.
Yeah. I mean, it's already been all over. I'm definitely feeling the effects. I'm seeing the effects on lots of my patients.
So because of the allergy season, let me ask you this, because I know some people have asked me. You get the sniffles, and you get feeling a little bit down. You get wore out. It just does. It just affects people differently, correct? So a lot of people are worried, do I have COVID? Yeah, or am I suffering something else because of the COVID scare, and every single symptom you had was COVID. It still is a concern, but do people need to go get tested if they know this is allergy season, or should they just contact SMDH Family Medicine and come in and take a look-see?
Certainly, if they have an exposure, they need to be, on high alert and get evaluated. Other things to watch for: if you have fevers, body aches, that's not usually just allergies. If it's just your typical allergies, it feels the exact same as the years before, then you might be okay to take some allergy medicine. But any question at all, like I said, sick contacts, fevers, body aches, or just allergies that are worse than usual, we're happy to evaluate you and help you to make that determination of whether or not you need testing done. Because for a while it was kind of hard. We had a lot of COVID patients that were presenting similar to sinus infections, and it all kind of goes together.
Yeah.
But usually there might be a couple other symptoms that kind of tip us off.
And then we had a flu, little problem with our flu bug coming into play in March, didn't we? And it actually lingered into April for a while.
Yeah, we didn't see it much last year, but we definitely saw it this year, especially around this area. Not really seeing it now, so that's fortunate. But unfortunately, we are starting to see a few more COVID cases again.
Yeah, and so they're starting to pop back up. And I know up east they had a bunch in a couple places. Matter of fact, going to be going to the Cardinals, and half the front office there got COVID. So where they got it, they have no idea. But you got people coming and going all the time.
I will tell you right now, the COVID cases that I'm seeing, they're not really quite sure where they came from.
Yeah.
Because, at this point, people probably are attributing the symptoms to their allergies or just a regular old sinus infection. And, unfortunately, we're seeing a couple more COVID cases.
It's not going to go away real fast, is it?
No.
No, it's not. Well, one of the things that keeps you young, right, is diagnosing different things. But what we want to remind people of is don't take anything just as automatic. If something lingers too long, if something is more severe, if something doesn't feel right, maybe you feel more pressure in your head, something different. It still may be allergies, but then again, it may be something more.
Yes. And I mean, there are other things out there than just COVID, that we still need to evaluate and treat. So I agree, absolutely. If your symptoms are lingering, it just feels off, it's not the same old allergy symptoms that you normally have, or it's just really severe allergies and you can't figure out how to get it treated, that's what we're there for.
Yeah. And there's a lot of that going to be going around, I think, with all this rain that we had. Yeah. Right now the pollen's coming out with the sun coming out.
I mean, you can see it on everything. So
you can see it in the air as you walked in.
Yes.
You can see that haze.
I saw a car driving around that looked green from all the pollen.
Green or yellow.
Yeah.
Mine's a black one, so that lands on it, it looks yellow. I thought, man, I didn't know I had a yellow vehicle, but it's looking that way. But people do need to watch out. And to help avoid that, people can't wear a mask out there if the conditions are too bad with too much pollution in the form of allergens in the air. It doesn't hurt.
No.
You know,
I
long as
I
you
don't
can
know that
breathe.
they've done studies to show how much it helps, but if you feel more comfortable and you feel like it keeps some of that pollen out of your nose and your mouth, certainly
Well, I've
you
actually
can.
done that when I've cut grass occasionally
Yeah.
because when you cut the
Definitely
grass,
cutting grass
I mean,
or doing something like
it's
that.
coming right at you. And if you have your nose open to it,
Yeah, definitely doing
and
something like that. It
and
might be
I have
helpful.
allergies. I have grass allergies. That's not good for cutting grass, okay? And right now, grass is not bad, but you know as well as I do with all this rain and stuff, it's gonna get there here in not
Yeah.
too distant future.
Well, and you're going to see more and more people cutting the grass now. 'Cause
Well,
it's
not only
growing like
that though,
crazy.
because the grass is going to peak. It's right now it's growing like crazy, and then when it peaks, and all of a sudden you're going to see the sprouts coming out. Yeah, it's going to be interesting time of year, and we've had enough rain to make that happen here a little quicker than normal. So be prepared for that. But yes, if you're going to be doing outdoor activities, to where you're actually going to be cutting grass, weed eating, doing different things. Just want to remind you you might want to wear a mask if you're doing that. A lot of pollen out there.
Yeah.
One last thing I want to talk about, and you may have something you want to talk about, is poison ivy. I was just out at our site south of town, and the baby plants of poison ivy are coming out thick and fast.
Yeah. I haven't seen any yet, but I know that the woods are definitely greening up, so I wouldn't be surprised if it's not
they're
all
coming
over.
out. They're starting to branch out. And everybody says, if it doesn't have 3 leaves, you don't have to worry about it. But there's other types like poison oak and poison sumac, and they're just as bad, if not worse.
Yeah. Now, I'm not as good at it identifying those, to be honest. I usually have to look out those pictures. But poison ivy is your pretty classic 3-leaf.
Sure.
I was actually kind of surprised when I moved to Kansas City and I found a lot of people who didn't know what poison ivy looked like. Because I think growing up down here, it's just automatic.
everywhere.
Everybody knows.
Yeah.
It's everywhere and you avoid it.
Oh, it's in Kansas City, too.
It is. I know. I had plenty of patients that came in with it, but they just,
Didn't know what it was.
not outside as much. So, but yes, so definitely there are your typical cases where maybe you can just put a little something on it to help with the itch, but it can get pretty severe. It can spread, and sometimes we do have to do a little bit more to treat it.
Yeah, and there are shots for poison ivy, especially. I know I had it bad.
Yeah, sometimes we have to give steroids when it is covering enough of your body.
And popped. I had to wear ace bandages to suck up the juices.
Yeah.
Because they'd be coming through a shirt. I mean, it just, that's the way it is. That's how my body reacts.
Everybody responds differently.
Yep. And one thing you probably learned in medical school, once you get poison ivy in your bloodstream, it doesn't come out. And it can emerge in the middle of winter. Just show up as a little spot on the back of your hand. How the heck did I get that? And it itches. And that's the craziest thing because it's been dormant for 4 months or maybe 4 years. So it's really crazy. And in my case, because I am severely allergic to it, more than likely going to happen. If you're not that allergic to it, probably won't bother you that much. But one of the things that bothers me the most, Tiffany, and you might correct me on this, is people want to burn that poison ivy to get rid of it. It just puts that oil up in the air, doesn't it?
Yeah, I wouldn't burn it. Certainly I've seen people who do break out all over because of that and can have pretty severe reactions.
Get into your lungs too, right?
Yeah, it can definitely make it difficult to breathe or swell up your face or eyes burning it. So you want to be really careful about that.
But if anything like this happens, if you have poison ivy, and I know the first time you get poison ivy, you don't really think about it. You just got a little itch over here and you start scratching it. Okay, well, if you look back down there and it's 3 times the size it was just moments ago.
Yeah, then you've spread it somewhere else.
Now it's on your
by
fingernail.
touching.
Yeah, it's going to move. Don't play with it, especially if you react that quickly to it. More than likely, you have a pretty bad allergy to it. Get to SMDH Family Medicine. Call them, set up a time. They can take a look at it. Yeah, there's over-the-counter medications. They don't cure it. They just take that itch away, so it'll let it heal.
Yeah.
But it'll last a couple of weeks sometimes, and it'll be
a lot of time
uncomfortable.
your body is going to take care of it, but it needs time to heal, and by stopping the scratch, that's where we can help it to heal
The
faster.
scratches do tend to leave scars, big ones.
Yeah.
So anyway, I know.
Got some scars of your
Oh,
own.
I've got some nasty poison ivy scars. So yeah, and the thing is after a while, you just look down there and you think, I remember that one. That's the sad part. You remember how bad it was when you got that scar. So again, we want everybody to be outside, enjoy the beautiful weather we're having. Maybe it's a little hot right now, but we're gonna have 80s next week. How's that?
Yeah.
Yeah, that does you better, huh?
Mm-hmm.
Yeah, 81, 82 for highs. We'll be near 60 for lows. You talk about some nice weather.
Yeah,
Now.
that's
There
some nice
we
weather.
go. There we go. But we want to thank Dr. Bland for coming in and spending some time with us. You are accepting new patients.
I am. Yep, and still shouldn't have any problems getting an appointment with me. I still have a lot of availability, so.
So, and she is a family practitioner, and she'll take care of everybody in your family. Mama,
I see all
daddy,
ages.
little ones, grandparents.
If there's something that you're just not quite sure if it's a service that we provide, we're happy to answer those questions. You can just call us. But I do a lot of things, a lot of variety being family medicine. So.
Okay, very good. So if you're looking for a new family physician, Dr. Bland is right here at SMDH Family Medicine in POB 3. That's Physician's Office Building number 3. It's on the campus of SMDH, 729-8000. And set up a time. Very cordial young lady. You can sit down with her. She's going to talk. And if she brings her mama in, you're going to talk for a long time.
That's
yeah,
true.
Shelley just loves to talk.
Uh-huh.
But be honest and upfront with your doctors. When you go in, if you have an issue, try and jot down as many different things that you have noticed that might be different, because even that one little thing that you don't think is a big deal could be a big deal, or maybe might give them a better idea of what that might be that's affecting you.
Yeah, and I'm happy to tell you if I think it's not a big deal. So.
Oh, most doctors. Well, I will say this: most doctors are.
Yeah.
There's some that so we'll need to keep an eye on this, but. Most doctors want their patients to feel comfortable, because honestly, when you go see a doctor, you usually just don't go see him to visit, have a good time, have a cup of coffee, which I like to do that. Dr. Al and I are going to visit here in June, and that's what we're going to have. We're going to have a cup of coffee, we're going to sit down and talk. But they go there because they are unsure, maybe insecure about what something has happened to them. Maybe they feel different. Maybe it's just normal aging. But it might be something else, and they're concerned. So when that happens, guess what happens? You put yourself under stress. Blood pressure goes up, different things start happening to your body, and the more you worry about it and the more you fret over it, actually the worse you're going to feel, aren't you? Sleep is going to get deprived. You're going to change your whole lifestyle because you don't know.
Yeah, I've seen that many times. And like I said, I'm happy to see you and talk it through with you. I'll ask some additional questions. And with the knowledge that I have, I'm able to help you determine if it's nothing or if it is something that we need to look into further. Sometimes we just need to provide reassurance, but other times it really is something serious that we need to look at. So.
Well,
I don't expect you to know that on your own.
Well, I wouldn't think so. And let me just ask you a real quick question, and then we've got some other stuff to do, but a lot of people go online because they get a symptom. Mm-hmm. Okay. And you already know what I'm going to ask, and I haven't even asked it yet. But when they come in, are they already self-diagnosing themselves before they ever get to you and say, Doc, I think I have these 7 different diseases because I have this symptom?
I think you definitely have to be careful with that. I never mind when somebody wants to educate themselves further and they want to look and see if they can't figure it out. But you have to be careful because the internet, it's just, if you don't have more information looking at what's on the internet, you might diagnose yourself with something really scary, and you might kind of get it set in your head that that's what you have, and you're just kind of going to make things worse. And really, it should be the doctor who helps you determine if that's what you have or if it's something else. So like I said, I never mind a patient that wants to educate themselves, but I can help guide you in that education. I can point you to resources that are reliable. You don't just want to look on WebMD and, think that your headache is from cancer. That gets scary.
Well, the thing that scares me the most, and I have seen this on some medical websites, is, okay, you have this symptom, but this symptom is with 17 different diseases.
Things.
But then they make recommendations for you to take a medication or an over-the-counter medication or herbal solutions. And because somebody sees this as a symptom of all these diseases, they take all the different things to try and cure it. And that may not be very good for their health.
Yeah, that can definitely be dangerous. Not only because you could be taking medications that could be, doing harm, but also you could be delaying care and you could be delaying a treatment that you actually need. So.
Don't play with your health. Get to SMDH Family Medicine. Call Dr. Tiffany Bland, and she'll be more than happy to set up a time with you. You just become a part of the family up there, really.
Yeah.
That's what it is like.
Uh-huh.
Once you know everybody. I mean, I was in there, and they gave me a pickle pop.
Oh, really?
Oh, yeah, because I said, do I get a popsicle for coming in? They said, yes. And I said, seriously? And they said, yes, so I got a pickle pop.
I didn't even know they had those, so I'm going to have to ask around when I get back.
That. And I thought, it was great. So that's what I say. You go up there. It's a serious business. Health is, but it's also very, very lighthearted. If you talk with the people and get to know them a little bit, it really becomes pretty nice just to go up there and sometimes just visit a little bit. So
it's a great group of people.
It is a really nice, good group of people up there, and we recommend it highly to you. Support your local hospital, SMDH Family Medicine, Dr. Tiffany Bland. Gosh, it's been 5 months that just 6 months since you actually really got started, right?
Yeah, it's kind of crazy how quickly it's gone by. It feels like it was just yesterday that I was starting. So,
how's the baby?
He's great. 9 months old now. He's into everything. Very mobile. Crawls, cruises, climbs. But stands a little bit on his own. Yes, he's very much into everything that he shouldn't be.
That's okay.
But he's a good baby. He's happy all the time, so we're pretty lucky.
Just like his mama. Happy all the time, right?
Yep.
Yeah, there you go. Dr. Bland, thank you for coming in and spending some
thank you
time
for
with us
having
on
me.
our Spotlight on SMDH. We have our Civic Record coming up in just a moment. Again, if you want to make an appointment, 729-8000. And you work what days are your normal days?
I work Tuesday through Friday normally.
Tuesday through Friday. Very good. Now, you weren't there last Friday.
I wasn't. We did a little switching around, but normally Tuesday through Friday.
Yeah, no, very good. No, there will be some exceptions there as well. Anyway, we thank her again for coming in, spending time with us here on KSMO AM 1340, FM 95.7.
Whether you work in the field or in the corner office, information